Okay, hello everyone, and welcome to Connecting the Dots with Dr. Ashaye. This is a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. Today's special. Many of you know how confusing, frustrating, expensive healthcare can be. And today I have one of my own patients, Elizabeth Miller, who also is a very experienced, actually second-generation insurance agent. And she's going to be sharing secrets on how to navigate the healthcare system in the US today. So Liz is talking from personal experience and as a professional health insurance agent of over 20 years. So you know this is going to be good. So, but before we get into it, you're listening to Connecting the Dots with Dr. Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land, Texas, where we offer stress-free healthcare with direct access to the doctor. And you can find out more on our website, intouchprimarycare.com. So let's get right into it, Liz. You're welcome, and thank you for being here.
Thank you for having me. It's definitely a loaded topic that we can hopefully break down some barriers and some misconceptions and offer people some tips and tricks today.
Yeah, absolutely. So can you share a little bit more about your experience as a health insurance agent? How long have you been doing this, and how do you serve your clients?
Yeah, so over 20 years. This month actually will be 22 years that I have been licensed. I started off in the property and casualty side. My dad was an insurance agent. And then, very quickly, started talking about life insurance. And, as I was talking, Dad said, no, you can't talk about that. You have to get another license. So I got my life and health license shortly thereafter. So January of 2024, I'll be 22 years licensed on the life and health side. So life and health really kind of became my primary about almost 8 years ago. Flipping over from the property and casualty, which is like auto and home insurance, because there's such a huge deficit for licensed professionals on the life and health side. There's a ton of life insurance agents, but not so many that focus on the health insurance side of things. So I'm now licensed in, I think it's 26 states. I dropped a couple of states this past year because I just didn't have anybody in there, but they're fairly easy to pick up. So lots of states, lots of rules, lots of certifications that I have to do every single year. But it's also one of the things that I love in the health side of things is that I get to do that research for my clients. It's one of what I call my superpowers. I think that God has given each of us superpowers, and research is one of mine. So on the commercial side, the personal line side, in the property and casualty, as well as the health insurance space now, I have experience across all of those different industries, whether it's, large commercial, small families, large families. So if you're a husband and wife and a kid, or you're a person with a fur baby, I can help out with any of those. And it's really a fun way for me to be able to get to use those superpowers to help other people. And that's really what is at the core of my agency, is being able to help other people every day with the insanity that health insurance has become.
Yeah, yeah. So that's where we're going with health insurance, right? So you've seen all kinds of plans all over the years. What do you think is a common misconception people have about health plans?
That they don't qualify for them. So on the Affordable Care Act side, people say, well, I don't qualify for Obamacare. So whether we're talking about Obamacare, the Affordable Care Act, the exchange plans, whether it's a state exchange or the federal exchange, everyone can get on one of those plans. That's the beauty and the benefit to those plans, and what they were designed for is that anyone can qualify for one of them. What they may not qualify for are the subsidies that are involved, which are based on your household modified adjusted gross income. I won't go into detail on that because it's a very personalized individual type conversation, but that's probably the biggest misconception, along with and this is just general, not even just health insurance, but on auto and home insurance too, is that insurance should pay for everything. Insurance isn't a warranty. So insurance is not going to pay for everything. And every plan has its pros and its cons, but your insurance should pay for at least something, right? So that's the important part, is that if your insurance isn't paying for what you think it's supposed to pay for, then having an agent in your corner is really ideal. because you get to call that agent and say, hey, I went to the doctor, they told me that it was $300 and I thought I had a copay or whatever. And that way you can really kind of understand what it is that's gone wrong with your policy. Or sometimes, and this is the unfortunate part, is that most of the time I find when people run into that, is that they either don't have the plan they think they have, or the provider is not billing the way they're supposed to. So when you have the insurance aspect of it, that provider has to file the claim properly with the insurance company for it to pay out. So those are really kind of the two biggest things. I don't qualify for the ACA, which you do, may not qualify for a subsidy, or insurance should pay for everything, or my plan doesn't pay for anything. And that's just usually a matter of figuring out where the miscommunication is.
Yeah. Yeah. So thank you for sharing that, because I know a lot of people have questions about what they qualify for and all of that. So someone is currently looking at different health options, and how do you recommend they go about it? Like, what would you say the top 3 things they should consider if they're looking for a plan?
Yeah, so it's kind of a loaded question. It's what I feel, it's very personalized. And the reason for that is there are so many different options, and there are different combinations of options that may fit better for you than they would for someone else. So I don't take insurance as approach of, one size fits all. We're in this age of, we go to a website, we, put all the groceries in our cart, and we click order and they show up on our doorstep. And I'm 100%, I love Shipt. I will ship all day long, but don't ship with your insurance, right? You want to make sure you're actually talking to someone. And the biggest thing that I can say on that, before I get to the exact 3 things that I would make sure that you consider, is never put your information in a website unless you specifically know whose website it is. And the reason for that is, unfortunately, there are a lot of marketing companies that sell leads, which is your information. You ever wonder why you get all those phone calls and emails? It's because you were looking for something somewhere. And a lot of those websites will actually, if you clicked on that link from Facebook or LinkedIn, they actually grab all of your data and push it out to that marketing company. And then that marketing company turns around and sells it. So just be careful about where you're putting your information online. I think that goes for everything, not just health insurance. But the first thing I'd say is trust, but verify the professional that you choose. So I have 22 years of experience. I'm very good at what I do on the research side of things. I often get told that I share more information than I probably should, but in my opinion, the more information you're armed with, the better educated decision you can make. And just because that person is licensed doesn't mean that they necessarily have the experience or the products that are going to fit your needs. So I'm what's called an independent agent, and as an independent agent, I have appointments or contracts with just about every carrier that's on the market that I have vetted to be financially stable and have good products. A lot of folks don't have all of those different appointments. They may only work for one company. So if that professional is representing one company, that's all they can offer to you. And that's not necessarily a bad thing, but it just may not be the best product for you. So if you're not sure, keep calling or give me a call. We'll get my information out here at the end. But just make sure that you're trusting but verifying that that professional knows what they're actually talking about. Second thing is to be honest. Please be shamelessly and unabashedly upfront with all of your stuff. And I know as a healthcare professional, Dr. Lola, you probably run into this a lot. Folks get embarrassed about what they have going on. And there's no way for me or Dr. Lola to be able to help you with your problem if we don't know what it is, right? So I've talked to, and I'm those people that know me know that I'm very blunt and upfront and very transparent, sometimes to the point of a fault, but whether it's erectile dysfunction or genital herpes, or you have really bad dandruff, whatever, how minor or major it is, as the professionals, we need to know about it, because if I don't know about those needs, I can't match a product to meet your needs. Same thing with the doctor. If the doctor doesn't know you got some itchy going on somewhere private, they can't give you the cream that you need to resolve that problem. So just really be open and honest about what it is that you're having challenges with. Because we will eventually find out. So there are some policies that are underwritten, and some folks think, oh, well, I just don't need to tell her about that because it's kind of embarrassing or whatever. I run into that with guys a lot. Most women are pretty open, but it seems to be the gentlemen, I'm speaking to you right now, that are a little bit abashed about what's going on. But if we don't know, I can't match the product. And then you're going to be unhappy with the product, and that makes me unhappy because you cancel it, and then we all did all this stuff for nothing. So don't do that. Just be honest and upfront about it. And then the third thing is be be curious. Ask questions. Don't be afraid of, asking what's called a stupid question. It may seem obvious to me because I've been doing this for 22 years, right? But I'm the professional, you're not. So don't be embarrassed or again ashamed about asking questions about how the policy works or what term I'm using works. The insurance industry, just like most industries, we end up with acronym soup, right? So we have all of these different acronyms and terminology for things. Well, if you don't know what it means, don't be afraid to ask those questions. One of the things that I love about my agency and how I explain things, how I teach my agents to explain things is with stories. So I use a lot of real life stories of if this happens, I've had clients that have gone through cancer. I had a client last month that had open heart surgery. She had a double bypass. I use those examples in how your insurance policy is going to cover so that you can really kind of understand, okay, you have a cold, you have a sinus infection, this is how it's going to work. You need an open heart surgery, this is how it's going to work. They are two very different scenarios. And that's kind of where that big difference comes in with what I do in my agency versus what others do. And I encourage you to be curious about those questions. If you get an agent that kind of doesn't want to talk about a policy or the different procedures, or they keep giving you the same pat answer over and over again, those are kind of some warning signs that they either don't have the right product for you or they don't know the product. And no fault of their own, but maybe do a little bit more research on what kind of an agent might be able to help you out. So hopefully that
Great.
helps out with some kind of top things to watch out for.
Yes, absolutely. I think those are really good points. And yeah, that makes a lot of sense that people should ask questions. They should be curious. They should be honest. That's really important. And then find a professional because it does make a difference. So you have seen a lot of plans and you decided to join us at In Touch Primary Care. And so why did you choose the direct care path?
There are so many, I think, misconceptions and disillusions with American healthcare. And one of the biggest issues that we have here in America is that we don't have health care. We have health insurance that pays for our healthcare cost. And I had heard about and kind of referenced, some direct primary care stuff, run across it before I ended up joining your practice. And I honestly, I didn't really get forced into looking at the model until my primary care physician of 20 something years retired. And then my kid's pediatrician, my daughter's now 15, she retired. And I'm like, well, what do I do now? So I had traditional health insurance. So I went out, like, go to my network, find a doctor. I highlighted them, did Google reviews to try and find a good doctor. And I went through probably 4 or 5 folks, and we don't even get sick that often. Like, I actually interviewed a couple of folks, and it was so challenging some of the doctors wouldn't even do an interview with me. I'm like, I'm not choosing you as a primary care physician if I can't even talk to you to see. And now I'm like, I will pay you cash even. Like, you don't even have to try and file it through insurance because they didn't even know how to bill that was part of the problem.
Right.
And so met you through our wonderful BNI Business Networking International group and was like, okay, maybe I need to look at this DPC thing a little bit closer. And I have to say, from doing, insurance, specifically health insurance, as my focus for over 8 years now, there is a night and day difference between the level of care and concern and accessibility and professionalism that you get from a primary care doctor that has a DPC model versus one that's using insurance. And I think that it is because when you have a traditional primary care physician that is in a network for their insurance, that doctor is really working for the insurance company. They're not really working for you, the patient. And it's sad and it's disturbing because that doctor, there are certain requirements that doctor has to meet in order to stay in network for that insurance carrier. And I remember talking to my now retired primary care physician, and she said, yeah, if I want to stay in network, and it was a major name, and it had a very sky colored logo. Y'all know who I'm talking about. And she said, if we want to stay in network with them, I have to see a patient every 8 minutes. I said,
Mhm.
I can't even tell you what I need in 8 minutes. Like, I don't even know what I tell you all my symptoms and you weigh me and do all the things. Like, every 8 minutes, like it's egregious on the insurance company side. And it makes the doctors not be able to do what you got into medicine to do, which is to help people and care for people. Like, you can't do that in 8 minutes. There's just no way. Yes, maybe if I had a hangnail and I needed it cut and sterilized, you could send in a nurse practitioner and do that. But anything else more major, you're just not going to be able to give the level of care. And so, I'm a single mom. I do very well doing insurance now, but when I was looking at, okay, if I'm going to pay for the direct primary care monthly membership and I'm going to pay for my insurance, I'm like, but I'm not really going to be using the insurance. I had the same question, that everybody else did. And I won't elaborate on that now because I know we're going to get to that in a minute, but I can tell you that the difference between being able to reach my doctor, Dr. Lola, when I'm on vacation or on a Friday night when I think that a bug bit me, but I really just sprained my neck, come to find out. And she's not even working, and I send a text message. I'm like, I think something's wrong with me. I don't know what to do. They're telling me go to the emergency room. To be able to have the care and accessibility to a doctor who actually cares about my needs, who cares about my children's needs, that is it's really truly priceless. There's a point, of course, that's taken food off the table that I wouldn't be able to afford it, but it is not anywhere near the expense that people think that it is. And so that's the huge difference between the direct primary care model and a traditional PCP model, is that the DPCs are working for you as the client, as the patient, and not the insurance company or some big administrative entity that owns, 48 different area locations. You're really working for each individual client.
Right.
That was a long-winded question or answer to your question.
No, I mean, it is a, loaded question, like you said. And I think even from my perspective as the doctor, that's what I realized at some point. Like the if at the end of the day, things have to align, like our priorities have to align and our goals have to align. And in the traditional healthcare system, it's really hard to have your goals align with the patient because you have so many other people in the way. So in this model,
Yeah,
your goals are aligned with that of the patient. It makes it a lot easier to care for the patient in the way they want to be cared for. So, so
absolutely.
one of a concern a lot of people have when they look into the direct primary care model is how they can care for themselves in other situations outside of primary care. So if they had an emergency or they needed expensive surgery. So this is a thing that, sometimes prevents people from going the DPC route because they're concerned about those other things that may happen, which is, usually DPC can cover 80% of healthcare, but of course, you're always concerned about the expensive 20%. So what would you say to those people?
Yeah, so it's the affordability aspect of it is what typically kind of comes up. Price is a concern for everyone. And, I've had some people say, well, is it affordable? And I said, well, everybody's level of affordability is different. My level of affordability now is very different than when I was leaving an abusive marriage and almost had to file bankruptcy because I was trying to keep my kids protected. Right. So there's a difference there between what's affordable for me and what may be affordable for someone else. So I use what you just said, that kind of 80-20 rules, Pareto's principles and that goes on to protection, but I can apply it to finances as well, is that about 80% of the claims, and it's actually closer to 95% of the claims that are filed with insurance companies are less than $5,000. Now, $5,000 might seem like a lot. I'm not saying that it's not a lot, but when you're looking at the cost of insurance that you're paying, if you're paying $500 a month for a family of three, four, or five people, and you could be doing a direct primary care and then saving on what you're actually spending to use the insurance, that's where a lot of people don't see the differences in what becomes affordable and what's not affordable. So you can pair direct primary care model. And what I did was I just dialed down my coverage. I said, okay, well, I don't really need a copay, right? Because I have Dr. Lola. If I have to go see a specialist, yeah, I might be paying a little bit more out of pocket, but the likelihood of me needing to see that specialist is much lower when I'm taking care of the thing, whatever the thing is, immediately versus waiting for it to get bad enough to have to see a specialist. So when we go back to that, there's no, America with Obamacare, we wanted to make healthcare a social service. Healthcare is not a social service in the United States. The direct primary care model is trying to move it back in that direction. And there are a lot more direct primary care models popping up all over the place and plans that are actually designed around using a direct primary care model with the private plan as that supplement. So there are a lot of different plans that will complement the direct primary care model that will take care of those 5 or 20% of instances that are very expensive. So if you have that surgery, the hospitalization that you need, or even if it's, you're having a baby, right? Like those kinds of things are really what health insurance was designed for, or the unexpected things, right? So we don't expect our car insurance to pay for our oil changes. We expect it to pay for when we lose control on a very slick road. It's been raining down here, hasn't rained in forever. You spin off the side of the road. That is what your auto insurance is supposed to pay for. You come down with cancer or pneumonia or bronchitis and have to be hospitalized. That's really what your health insurance is designed to pay for. It's not really designed to pay for, I have a sinus infection that won't go away. That's when you have Dr. Lola on your text messages and you go, I need this. And she does a little phone call with you and goes, wow, you look really bad. Let's call in a prescription for you. And then it's done. You don't have to pay an extra copay. You just got to go over to the pharmacy and pick up the prescription that she calls in for you. So the actual total out of pocket expenses that you end up having under a direct primary care model are significantly lower. And that is what really frees up the monthly cost to join that direct primary care model. But you have those other policies that we can put together, whether it's a high deductible Affordable Care Act plan or a package of private plans or even a short-term medical plan. They're not short-term anymore. You can renew them for 3 years. Or under the current legislation, you can, which might change depending who gets elected in office next year, which is a totally different conversation. But vision and dental as well, they've always been separate plans. So you can
Right.
always have those as standalone plans. There's a lot of different structures that we can look at so that we're creating a customized plan that's going to fit you and your family's needs and budget.
Right. And thank you for saying that, because I think that's the part that people don't realize sometimes. The importance of having a customized plan, not just because everybody's different, first of all, and then things change over time too. So you want to have that flexibility to be able to have a customized plan that works for you for now. So I think that's helpful, and that's where having a health insurance agent comes in. All right. Any last comments you like to add? Any tips, tricks, or mistakes, stories you want to share before we end here?
How much time do we have? I got a lot of stories. No, I will. I'll just kind of close with this. Don't assume that your plan is going to cover something. Please listen to what the agent is saying. There are a lot of private policies that have pre-existing condition waiting periods, and people say, well, Obamacare did away with that. Yeah, on an Obamacare policy. But if your agent is telling you that pre-existing conditions are not covered, you have to listen to them and not hear what you want to hear. You have to hear what they're actually saying. And then finally, don't change your Medicare plan, please. 65 and over folks, please don't change your Medicare plan unless you are absolutely 100% sure that it's what you want to do and you understand the ramifications of it. It is actually illegal for someone to reach out to you to solicit or review your Medicare policies. You are actually required to reach out to that agent. And the reason that I say that is if you have a supplement and someone is trying to sell you a Medicare Advantage plan because it's zero cost, you may lose that supplement forever. There's a period of time that you can get it back, but those supplement plans after your initial election period are underwritten. And so there are circumstances where I have barely squeaked in someone who got a phone call, thought it was better, I don't have to pay anything, and they were moved to a Medicare Advantage plan and then didn't have the option to go to MD Anderson and they came down with cancer. So just please be very, very careful about taking unsolicited phone calls. Make sure that you're asking for that person's license number. And if you're not sure, reach out to your property and casualty insurance person, your auto, your home insurance person, and ask them if they have a health insurance agent they can refer you to. Or feel free to find me at lizmilleragency.com. I'm on Facebook, I'm on Twitter and Instagram and LinkedIn. Just look up Liz Miller TX or Liz Miller Agency, and you should be able to find me. But the easiest way is going to be at lizmilleragency.com. You can book a discovery or review call. It's 15 minutes. I don't charge anything for those. And that way you know, okay, yes, I have the right thing, or so-and-so is telling me that I need to change because I can save money, and I will let you know, yes, do that, or no, please don't do that, and here's why. I always tell you why. So
Great.
hopefully
Yeah,
that's
thank you
helpful to
for sharing.
everybody.
Yeah, that is helpful because Medicare, people on Medicare can be more vulnerable. And so it's really important that they're clear about what options they have. So thank you for sharing that. So we've come to the end of this wonderful session. This has been great. If you have found this helpful and you are in the Houston or Sugar Land area, please do not keep this to yourself. Share this episode with people around you. Also, I wanted to make an announcement. We're having an open house here at In Touch Primary Care Thursday, October 19th. It's going to be from 12 to 4, and you're welcome if you're in the Houston area to stop by, say hi. Liz is going to be there along with other agents to help you answer questions that you might have. So that's another opportunity for you to get some answers. And if you want to learn more about our practice here, you can also schedule a free 15-minute consult on our website, and we'll have that link in the caption along with all the other links Liz mentioned earlier. So thank you for listening, and I look forward to seeing you next week on Connecting the Dots with Dr. Ashaye. Take care.